Good afternoon, everyone. Thank you for attending the CSI Reporting Portal and Community Page training. My name is Lauren Johnson, and we'll just go around the room. If you are on the phone, could you please type in your name and organization for attendance purposes? We aren't going to go through everyone because there's quite a few of you on the phone, and that would probably take us a while. So we'll start with Carol.
So Carol Moser, Greater Columbia ACH Executive Director.
Diane Halo, Project Manager for the IMC and the Opioid Resource Network.
Les Lucky, Deputy Director for the Greater Columbia. Martin Sanchez, Practice Transformation Navigator with Greater Columbia.
And Jeff, would you like to introduce yourself?
Sure. Hi, everybody. Jeff Wasserman, and I'm a webmaster from the Healthcare Communities Portal.
So I'll just go ahead and start. Today we will, like I said, we'll be reviewing the reporting portal community page. We sent out an email, I believe it was last Monday, the 17th, and everyone should have received a email prompting them to register for the portal. So far, I believe we have 43 people registered, so that means we still have about 67 to register. I did send out another email blast about 30 minutes ago, so hopefully everyone that has not registered yet received that. It seems to be a pretty easy process to register, and Jeff will review that with you a bit. Our hopes for this training is to get you all familiar with the portal and the community page and prepare you for inputting your reporting for Q2, which is due July 15th. So with that, we'll go ahead and hand it over to Jeff, and he will be taking you through the community page, and then following that, Jenna and Martine will be taking you through the reporting portal.
Great. Thank you very much, Lauren. I'm going to go ahead and share my screen here. Okay, and can everybody see my screen?
Yes, we can. Yes, Jeff.
Okay, wonderful. Okay. All right. Well, good afternoon, everybody. Again, I'm Jeff from Healthcare Communities Portal, and we'll spend about 30 minutes here kind of talking about the portal, kind of get you a little bit familiar about what it's all about. We'll take a look at the Greater Columbia homepage, kind of what you can expect within the community, and just some kind of tips and tricks, if you will, about your use of the portal to kind of make your life easier. So as Lauren described, there is going to be largely one way to get inside the Greater Columbia community, and that's by invitation. Now, once you receive that invitation, there'll be a link where you can complete the registration. It looks largely just like this, so there are a few fields here that you can fill out. You'll choose a username and a password. Just confirm or agree to the terms of use. And then once you do that, if you have clicked on the invitation, you'll automatically be a member of the community. And the next time you log into the portal, you'll then see, when you log in, the Greater Columbia tile in your set of My Communities. So that's going to be kind of how you will get into the portal inside of the community. Before we jump into the community, I'll just point out there is a full listing of available communities. Again, some communities are by invite only, but if they are by invite only, you won't see them on available communities. So if you do your registration before you get the invite, you won't see Greater Columbia listed here. There are a number of other communities. I think there are about 70 or so communities now, and you can find other communities if you're interested in by typing a few keywords here. So if you're looking for something that might deal with high blood pressure or diabetes or anything like that, you can enter in some keywords to kind of filter down the communities that might be there. The only community that I'll really kind of point out, there is one community that we manage, and that's the HC community that has about almost 6,000 members. That is a very active listserv with a few thousand people on that listserv. a lot of things that get discussed on that are things like job descriptions or questions about advice on, moving from one EHR to another or dealing with vendors, etc. So feel free to look and see what other communities might be of interest to you. Otherwise, once you are logged in, you'll see the Greater Columbia tile. I'm logged in as just a regular user right now. And on that tile, I can click to go to the Greater Columbia community, which will take us right to the homepage. And the community homepage is sort of a roll-up or kind of dashboard, if you will, of all the content that is in the community. And we'll kind of go through all the content in the community and what that's all about. So basically, you can see here on the left-hand side, we've got some left-hand navigation here to some of the items that are within the community that we'll talk about. There are a few kind of quick links. Some of the items over here on the left-hand navigation are just repeated here on the top of the homepage, including calendars and documents and a few other items that we'll talk about. As we scroll down, we can see a folder tree, which will list all the documents and document folders. Below that, a photo gallery. We click on that, we can see a few people waving hello. And we've got some announcements, some outside links, some upcoming events, and the latest 10 documents that have been added to the community are listed here on the homepage. So if you're coming to the community and you're looking for absolutely what's new, you're going to be able to find that on the homepage, and especially with the recent tools and resources, those are the last 10 documents that have been uploaded to the community. Okay, fantastic. So now let's kind of drill down and take a look at what this is all about. So let's take a look at one of the really big things for pretty much every community, and that's the documents. So we can get to the documents in two different ways. We can go to the documents by clicking the link over here on the left, or we can click on the link over here in the icons. We also have the folder tree. And so with the folder tree, you can kind of expand these folders to see what folders might be underneath. There are some private folders underneath the IMC organizations and underneath the PCMH organizations. There are a number of private folders. You're only going to see those folders if you are actually given permission to see them. So you're not going to see folders for other groups or other organizations that you're not aware of. You're largely going to only see your own. So for example, with this user that I'm logged in as, they've been given access to the Garfield County Hospital District Pomeroy Medical Clinic folder. So there's a little lock icon on that. They know that it's a locked folder, and if we can expand that out, we can see that we've got a number of locked folders underneath here. Now we're going to take a look at downloading. We're also going to take a look at uploading files. While we're here, I'll mention that if you do want to upload files, you would want to upload them into these private folders if you've got anything that you want to upload there. So that is where you would want to do any of the uploading of the files.
Jeff, this is Lauren. I'd like to add a comment. If you could expand that box one more time, that folder. So the purpose of these folders, like Jeff said, each organization has their own folder, and these should match the file structure that you previously had in Dropbox. So if you had certain documents under assessments in Dropbox, they will match what is in the portal. So it should be fairly easy to find for everyone.
Wonderful. Okay, so I'm going to go to the documents. I'm going to click on Browse All Documents here, and this will take us to the Documents page. Again, it's kind of a repeat here that we're seeing with the files. Let's go ahead and drill down into a folder. And what we'll be able to do is kind of see what that looks like here. So we've got one file here in this Community Health Workers folder. If I wanted to download that file, all I've got to do is click on the link right there, and it will download it to my computer. If you want to see more details about that file, we can do the little more drop down, and we'll get the details of all that, when it was uploaded, etc., who uploaded it, file size, etc. So that just gives you a little bit more information. Now, you might find folders where there might be a bunch of content in there. In fact, maybe there are 10, 20 documents. Instead of having to click on every link to download those files, there is under folder actions a zip and download. This can be real handy because, again, if there are like 20 files in there, you don't have to download each one. You can select zip and download. What the documents will do is it'll zip up all the documents into a zip file, and it'll download that zip file. And then you can open that up and unzip it, and it'll be all the files that are within that folder.
Jeff, this is Lauren. We had a question in the chat box I just wanted to answer really quick. So the purpose of this portal is...
re-enter your...
Sorry, we're getting some feedback. The purpose of this portal is to eliminate Dropbox. So this portal will replace Dropbox. All of the documents that the organizations had in their Dropbox will be moved over to the individual organizations folders that are locked. So we'll include your contracts, your assessments, your PTIWs, all those documents in your own individual folder. Okay, go ahead, Jeff. Thank you.
So let's take a quick peek here at uploading files. So underneath that folder actions where we found that zip and download, there is a add new files option. So if we click on add new files, we're going to get a little pop-up. And what we can do is click on upload files. And then here we can drag and drop those files. I'm not going to upload anything. Basically, you can imagine that we would just drag and drop from a folder on our desktop, however many files we wanted to, and they would then all begin to upload. I'd then just click on the add files, and it would automatically get all that stuff queued. Now, if you don't want to do the drag and drop, we can click on the upload files again, and if we do click in this box, it's going to open up an option for us to select files on the desktop. And again, you can shift click, right, to select multiple ones, or you can hold down the control key and just select some non-contiguous files. For example, if I click that file, then I hold down control, it'll then allow me to then just select some random files in there. So you can see that all got queued up. And then I'll click on add files. I can then add some keywords to these. Now, let me explain to you real quickly about how the search engine works on the portal. As soon as you upload documents, the search crawler is going to go through all the documents that you've uploaded. This is going to include not only meta content like the title of the document, what the file format is, but the entire document itself. It's going to look through the entire PDF. So quick tip, if you are looking to redact information, don't add it to the document, because even if you put in black text on a black background, the search crawler will find that information, right? So the search crawler will go through everything. So no need to add keywords that are already going to exist in that document, right? So if the document is all about fish, no reason to add fish as a keyword, because it's already going to crawl it and store it already. So no need to do that. Make things that are going to be unique. You can add remarks to these files. So we might say something like, this is the pre-work you asked us to complete, right? So that kind of gives somebody an idea about what that document is all about. Finally, you have the ability to utilize categories. Not something that we're going to talk about today, not something you need to worry about. Whenever you upload files, for all intents and purposes, you'll just be uploading them into the folder that you've selected to upload all those on. I'm not going to click on save, but if I did, everything would upload to the server, and the search engine would then start indexing all of those documents. Now, talking about the search engine, let's take a look about how to search within the community. Now, on the community homepage at the very top, there's a search box which will search not all communities that you might be a member of, or the entire portal. That is up here. So if you wanted to look for something like diabetes, it's going to search everything on the entire portal, including some public resources that are found underneath the resource centers. But if you want to search directly for the files within Greater Columbia, we'll do that right here. And I'm going to just put in shared decision making and do a search for that. And that's going to come back with about 29 different files. And it's also going to give me a bunch of additional options for searching. So for example, if I scroll down here, I see that I've got some PDFs. A little below that, we've got some Word documents. Well, for the sake of example, let's say that I know that the document I'm looking for is a PDF. Well, I can filter that out and say filter by type, documents, PDFs, and then update my search. And then instead of 29 items, now I've got 5. And that kind of can cut stuff down. Now, another really great thing to utilize in the kind of the advanced search here is looking for files after a date, because you might search in Greater Columbia for a file, maybe in 6 months, there might be hundreds and hundreds of files, but you know the file that you're looking for probably was uploaded 3 months or earlier, right? So here we could say, well, I know that it was probably in March or later, so I can go back to March and do on or after March 1st. Now, the community just really launched, so we're not going to really get any results here, but you can probably imagine that over time, this can be really useful, especially if you're looking for documents that you know are fairly current, been added fairly recently. Okay, there are some additional options for searching. I won't go through all of them, but feel free to look at them, you know, doing an exact phrase or any of the keywords versus all keywords. But I can tell you that it's been our experience, even with communities that literally have, you know, 3, 4, 5,000 files, the search engine can be very helpful in finding items. Okay, I'm going to jump back out here and let's talk a little bit about events. So just a reminder, on the community homepage, there are some upcoming events. It's going to be the next 5, up to the next 5 events over the next 2 months. And from here, we can click on any event and look at the details. We can also go to the calendar, either by the calendar link in the icons in the left-hand nav or by clicking the Go to Community Calendar. And here we are at the calendar. By default, it'll be the month view. My user is in Pacific time, so all the events are going to be in the correct time zone. So even if somebody created the event in the Eastern time zone, it will adjust appropriately for whatever time zone that you're in. So we can see that we've got a few different events. Some are gray, some are blue. What does all that mean? Well, we've got a legend right up here. We can see that any event that is blue is a monthly event. Okay, perfect. You know, there are some other default categories here. Special event is purple, weekly event yellow, monthly report, lime green. And on here, we can switch the view either to a week view, to a day view, but month view by default typically seems to be pretty good. We can click on the event. That's going to give us some additional information, kind of teaser text in the pop-up here. And if we want to find out more about the event, we can click on the read more. Let me see if we've got an event that might be in July. Perfect. Oh, so right, we've got a special event here on the 15th. Let's take a look. I'm going to click on the read more. And it looks like, okay, it just might be a placeholder for now. No big description or anything like that. But maybe I want a reminder set up about this event that'll happen on July 15th. Perfect. Here's my email address. I'm going to go ahead and set up a reminder. Oh, let me go ahead and make it an hour before. Then I can set up a notification about the event, and I will get a reminder an hour before via email that the event is happening. Great. If I decide I don't want that event, I don't want a reminder, no problem. I can delete the reminder. No big deal. Another option I have is I can download the event to my calendar. So if we click on download to my calendar, that's going to just download a standard calendar file that can be opened up in Outlook or Firebird or any other calendaring app. And when you double click on it, you'll be able to add it to your calendar and just say Outlook, just like you would if you got an email from somebody with an invitation. That way it's on your calendar. You can set up a reminder for that if you want for any period of time and go from there. So the calendar is good. We'll talk about downloading, setting reminders. So events are usually a pretty big part of the community as well. Okay, let's go ahead and take a look here. One other cool thing are the list of members within the community. That's over here on the left-hand nav. So if I click on the members page, it'll open it up in a new tab, and we're going to see a list of all the members that are in the community. If you want to connect to anybody, not a problem. If you click on their name, you're going to see all their contact information. So from here, if I wanted to email Donna, I could just click on the email link right there, would open up a new email in Outlook, and I can email that person. It also gives you some ideas about, where the location is or what organization they're part of as well. If I want to search for somebody, I can do the same. I can just type in something here, and it'll filter out everybody, and I'll get whoever I was hopefully looking for.
Hey, Jeff?
Yes.
Is there a way to, not that this would be a requirement, but is there a way for a person to upload a picture that can be tied to their profile?
Great question. So we once had that functionality. We don't have that available at the moment. They ran into an issue, had to do with an Arnold Schwarzenegger picture. Anyway, it's a long story, but due to that, at that point, it had been requested by some groups to no longer do that. So at the moment, no, but that is something that is on the top of our mind. So that might be something that we see in the future here. Okay, let's go back and take a look at the listservs. Now, when you joined the community or you accepted your invite, you are automatically added to the listserv for the community. The listserv is a page here on the community, and it allows you, by default, you're going to be, if you go to it, you're going to see that you're a member of it. And the listserv basically is an email correspondence that you can email other people. So basically, if you came to the listserv page and you clicked on the listserv link right here, it's going to open up an email up in Outlook, and you'll be able to email everybody that's on the listserv, which of course by default will be everybody within the community, to ask whatever question you would like. And that's kind of real time. So when you send out the email, it'll go to everybody that's a member. Additionally, we have archives set up. So if you, of course, not applicable to you all if you're already in the community, but the archive, every email message does get archived. So in the future, if you wanted to look back through the archives, you could click this link here. You could also, do a search and look for maybe some type of particular content or search by a particular user to find that out.
Hey Jeff, this is Carol. I just had a question on the listserv. So I know that this is access that has the potential to be abused. Do you know if any of the other ACHs or any of your learning communities have policies on the use of those listservs, or I just wondered what our members feel about potentially getting pinged 3 or 4 or 5 times a day because now all of a sudden there's a listserv that everybody's accessing and they're advertising all sorts of events or those kinds of things.
Great question. So the listserv in the Greater Columbia community is not moderated, which means that anybody that sends an email, it's not going to be held for moderation to be reviewed. It'll go out to the group. Now, that is fine. Now, we got to remember that Greater Columbia is an invite-only community, so there is that kind of level of trust built in, right? So, they know who they're inviting, and there's sort of that level of trust. But that listserv can always be moderated. So when listservs, end up having a lot of users, right, you tend to see things get a little bit hairy sometimes because, somebody might want to kind of advertise their services, so to speak. And so when you begin to get a little bit larger, that's when moderation can come into play. We've talked about that with the Greater Columbia group very recently. So that's something that we'll leave in the Greater Columbia's hands, but that listserv can always be moderated. Now, in terms of saying, oh, you know what, people might be getting pinged 4 or 5 times a day. You know, we all get way too many emails already. You know, what does that look like? Well, there are options with the listserv, and I will kind of show you where to find this information before I wrap up here shortly. But you can set up to get a digest, which means that instead of getting every single email in real time, you can get a digest, which I think will come either early in the morning or late in the day of all the emails that have kind of gone across. So instead of getting 5 emails or 10 emails, you're going to get one, no more than one every day, which will have the digest, and it'll have the thread of all the emails, and you can reply back to the list if you want to with any comments, questions, concerns, whatever. Does that help? Okay. Okay, very good. All right, so one thing I want to talk about here. So largely we've talked about all the content in the community. Again, on the homepage, we've got things like the announcements, and I'm sure they'll be adding more. Outside links, which are great links that'll open up in a new tab for you or a new window. We talked about the photo gallery. Latest videos. They've got a bunch of videos here that have been added. Let's go to the video library, which you can do by going to, you can get to it by the navigation on the left, or we can click on view all videos, or we can click on a particular video and it would take us there. But the video library is super cool. So they upload a big video file, and on the back end, it gets put into creates a streaming media file. So you don't have to download the file. You don't have to install any software. You don't have to have iTunes or QuickTime or anything like that. You can watch the video right away from here. So you can click on play. You know, it's got a smaller window by default, but you can expand that window. I'm going to mute that and do full screen, right? Give the video a few seconds, up to 10 seconds, for it to kind of play. It'll determine your bandwidth. You can see that it was pretty fuzzy, and now after about 10 seconds it determined I've got high bandwidth, and the quality of the video is much better. So the video library is great. You can search through the video library. They can add keywords to anything. You can search through it. And they've got what are called different channels. So we've got the Greater Columbia channel. We can click over to the Leadership Council Meetings channel. We've got a bunch of videos in here as well. And then the Learning Collaboratives. And because there are multiple channels, I do want to point out when a search is done, it does search through all the different channels. So you don't have to worry about having to search for a keyword in each individual channel. It will search all of them. So video library is pretty cool, and I'm sure they'll probably be putting the call that we're having today up there as well over the next few days or early next week. So you'll probably be able to find that here as well. Okay, want to point out one really cool thing. Now, some users, they like to come to the community every day and they like to see, oh, what's new? And there are some people that like to kind of be alerted about what's new. And again, we talked about, the deluge of emails that we all get. But I want to point out something kind of really cool. If we go to any documents folder, I'm going to just go to the general folder. We have the ability to subscribe to a folder. So if I click on the general link here, I don't know if you can see the mouse over on the screen, but it'll say subscribe to general. And what that'll do is set up a email so that anytime content is added to the general folder, I'll get an email reminder about that. So I am going to go ahead and do that. I'm going to go ahead and click on general, right? And I'm now subscribed to that folder. I now see a little icon here, and if I mouse over, it says unsubscribe. And I think by default, it's going to be once per day. But if we look in the My Profile section, there are going to be we're going to have a menu item over here called Content Notification Settings. I'm going to click on that. And from here, I can determine how often I want that to happen. So the only email I'm going to get is about that general folder if anything is added, and I could subscribe to multiple folders. And then by default, it's set up a notification for once per day. But I can come in here and I can change that. You know, once per day, maybe that's too much. Maybe I want once per week. Or maybe I want to get really crazy. Yeah, I want live updates, right? Anything that you want to do here, you can set up for documents. But that's not the only thing that you can subscribe to. You can subscribe to the calendar, so that anytime events are added or updated, you get reminded about that. Announcements, forums, and the video library as well, so that when new videos are added, you would get notified as well. You know, again, you can do as little or as much as you want, and as frequent or as infrequent as you want. But just want to point that out, that I know some people really like to just kind of get a heads up via email instead of having to maybe log into the community every day. So that's one nice thing that you can utilize. One other thing I want to point out is kind of everything that we've talked about here today. We do have a help system. I'm going to go to the help. And anytime that you guys have any technical issues, for example, let's say you received an invitation and it just, for whatever reason, it's not working right for you. Or you tried to do a registration and it tells you that you've already got a user in there or something like that. Anything like that, let us know. You know, this is a national help desk that we monitor. It's monitored by multiple people. And you can just select your program here, which would be Greater Columbia. Question would be about a portal technical issue, and then et cetera, you know, maybe it's about portal membership. There are a few drop downs here, but in here you can enter in your question, you can add a file. Screenshots are always great, and then just submit that, and that'll get triaged to the right people, so that your question will get answered in a timely manner. So if you run into anything technical like that, let us know. You know, if there's anything that is, you know, contextual, like, hey, I'm looking for the so-and-so document in Greater Columbia, it doesn't look like it's there yet, that would be something that you would probably want to ask Greater Columbia, because we will not know the answer to that. But everything that we kind of talked about here today, we have a FAQ system here, so we have a getting started FAQ with a few videos, and then we have all FAQs. And everything we talked about here, we've got help here on the side here. So if you wanted to learn more about documents, uploading files, subscribing to folders like we just looked at, calendaring, you know, how to download an event to your calendar, etc., the videos, all of that is here. So feel free to utilize that as a resource. And if you don't feel like reading anything and just want to ask us, hey, not a problem, feel free. We're more than happy to help you out, and we'll get your questions and concerns answered.
Jeff, this is Lauren. I do want to comment. Your help desk is actually very helpful and very responsive. We had some problems in the beginning getting our staff registered, and I got an answer probably within an hour. So thank you for being so responsive.
Of course. Glad. Thank you for your kind words. Okay, Lauren, unless there's anything else you wanted me to hit, I think that is largely it from the community side.
Can you touch on the forums, Jeff?
Absolutely. Let's go back to the Greater Columbia Community homepage. And in the left-hand navigation and in the icons here, we have the forums. So unlike a listserv where you're getting an email kind of real time, or the once daily if you do the digest, and I should point out that information about how to do that is in the FAQs and your listserv. The forums are a little bit different. So if you had a question, you could come in here and you can select the appropriate forum here. Looks like there's one for milestones, and we have one kind of a general forum. So we might go into the general forum here, and you could add a new thread and click on the new thread button. You know, you put in your subject here, so it might be something like, you know, has anybody had issues exporting XYZ data from their EHR, right? And then you can say, oh, you know, we have this particular EHR and we're having trouble getting the data out. Or it can be something, you know, hey, we're trying to measure, you know, get an accurate measurement of A1C with our diabetes population, et cetera, whatever the case might be. I'm not a subject matter expert, so please excuse the made-up examples. But you could type in whatever question you had here or a comment. You can add an attachment if you want, and then you can submit that, and that'll create a new forum post. And then other people that will come to the forums can see your post, and maybe they have some comments about it. But if you're looking for, you know, a less direct, if you will, communication, the forums are a way to do that. You additionally can do a poll. Anybody can do a poll. Basically, you create a question. You select your answers. You know, question might be, what's your favorite color? Answers can be things like red, blue, green, turquoise, clear. You know, and then you could show the results to anybody that completes the poll, and then you could select an end date for the poll. Like, oh, you just want to find out, you know, what people think about this particular thing within the next few days. So that is something that you can create as well. Lauren, I don't know if your team, go ahead. Yes?
Is the poll simply one question, or can you do multiple questions?
The poll is just one question, very simply, you know, whatever it might be, and then you can add whatever answers would be appropriate.
Thank you.
Jeff, another comment to make. On this forum that you guys are seeing, you guys can ask any questions. You know, for example, we had earlier, before we had this portal, we had a question about what hospitals are doing to do bidirectional integration, and so we kind of sent out an email. So, but this would be a good spot to kind of post those type of questions and get feedback from other organizations as to what they are doing. You know, for example, bidirectional integration, or you know, what workflows they're using for care management. You know, things like that.
Wonderful. Yes. You know, I mean, a forum is as valuable as its users, so always suggest that people get engaged with the forums. They can really grow to be something fun and exciting. Okay. Lauren, was there anything else you would like to go over today?
No, I think that covers it, Jeff. Now we'll hand it over to the navigators, and they can review the reporting portal. Thank you.
Thank you.
Okay. So from this landing page, you know, this is what Jeff was going over, and all the announcements, calendars, and all that. To get to the reporting portal, you guys would have to click Greater Columbia Measures. So just click on that, and it will take you directly to your folder. You will only see your folder for your organization or whatever folder you have access to. They will appear on this drop-down menu. We are seeing all of the folders right now because we are admin, so we have access to all of the folders. So we'll use a folder that doesn't have anything in it. I'm looking for it. One. And then for quarter two, it's already listed on you on here for quarter two, but we will look at quarter one. So going back, it doesn't have anything on here, but this is a good example on how to navigate. Once you click Q1, you go over to the drop-down menu under milestone, and all of the 8 milestones will appear. So we will go to milestone 1. And this is exactly the same milestones, the same layout as the workbook that you guys had used for quarter 1. This is just a much nicer way of reporting. And on here, it's the same format for the budget, which is milestone 1. And you just enter numbers on here for your budget. And once you enter some numbers on here, you will see that on the right-hand side, this is blue, and then that's because you already entered some data on here. If once that turns blue and you're, you have entered in your budget, you hit save, and that will turn white. So that means your data is saved. And then this, you click on it, it takes you directly to the top, and then you can move on to milestone 2.
So also just to mention, all the data that you submitted in Q1 will already appear in your workbook, which is why Martine had to scroll to find one that didn't have it, because all the rest of them are populated. So just no fear, you don't have to re-enter all of your Q1 data again. And that Q1 data pulls over to show in Q2. So you'll just be updating. You won't be re-entering new data from scratch.
Right. So trying to save you guys some work. So milestone 2, as you guys know, this is kind of the monster of the workbook. And it's again laid out the same way as in the workbook. On here, you guys will see the empanelment piece, and you guys will enter your numerator, denominator, and then the number of primary care practitioners or team panels. And this will automatically, like Jenna said, will roll over to the other quarters.
I think we had a question in the chat box.
And we have a question, so we're trying to.
Never mind.
Okay. Okay, never mind. And then, so this is the empanelment. Then if we scroll down, you guys will see the risk stratification, methodology, and types. And on here, it's for you guys, it's already selected. So whatever you guys selected Q1, it will appear as marked for Q2. And these are, you can select multiple options on here. And these are just examples. So I'm just kind of clicking. One thing to note, there are spaces on here that you can do some text. For example, this one is publicly available algorithm. Please list known criteria. So on here, you would list that criteria. If there's any other, for this one, other psychosocial or behavioral risk factors, please list, and then you guys will list them on here if you guys click on this option. And then on all the questions, there'll be an other box that if something doesn't show that you guys are doing, or for some reason it's not showing up, you guys can always write it on here as well. And then if we scroll down more to question number 2, this is, provide a narrative as to how you guys are using the methodology or tools to risk stratify patients and how this is being recorded in the EHR. So you can write a narrative on here, or you can choose to upload a file. If you have it on a Word document, you just hit upload or choose file. So choose file, and then it should let you, select your file. And then once it's selected, you can hit upload, and it will upload onto this section. And then risk stratification statistics. So this is similar to the boxes under the budget. So you would, list your numbers on here, and this will automatically add the totals and then show your percentages on the right-hand side of the column. So we'll add some numbers so you guys can see on here. And then we'll hit save. And once you hit save, you guys will be able to see the calculations that it does for you. So we'll just wait a few seconds, and this should give you those numbers. And it usually does take a few seconds to show. So don't panic if nothing's happening, because that happens to us all the time. See here, you see the calculations that it did, your percentages, And then down at the bottom, your total and how many patients are receiving the care management services. Cool. And then you see here it turned white once I hit save. And then once we click on some more buttons, you guys will see that turns blue again. So opportunities for those at highest risk. Again, this is multiple selection. So you guys can, select all or select, whatever you guys are using. So, and you guys see this turn blue on the right-hand side. If we keep scrolling down, select the care management services or activities that your practice uses for patient population. And again, it's multiple selection. And then there's the other section where you guys are able to type it in. And we had a comment. To get on here, you guys, from the landing page, you guys will hit Greater Columbia Measures, and it should show your folder. So the question was, how did you get into this again? Greater Columbia Measures, you guys will see your folder. There's some 3 drop-down menus that will say the folder, the quarter, and then the milestone. And then you guys, it's on here. There's the organization, quarter, and milestone.
The Greater Columbia Measures is located on the left-hand pane in the Healthcare Communities window. You'll see it off on the left.
So scroll down, describe when your staff provides care management services. Again, just entering the numbers on here. And then there's the other. If some members of your team are not listed on this list, you can always type it on here.
And again, you guys have already populated the first
Yeah.
quarter. But if you have new information, like somebody gets hired for a new position, does it keep the old data?
Yep.
Then?
You can just add it on.
Yep.
And just hit save, and
All
it
right.
should stay on there. And then here's the narrative box again. And then we scroll down to milestone 2B1, which is bidirectional integration, which is something you guys will have to report for quarter 2, July 15th. And then again, choose the type of health integration model. There's a brief collaborative, and then we made these that you can click multiple options because some of the organizations that we are working with are using a combination of these models here. So we made this option available to have multiple selections. And then this specifically specifies other form of integration. This is specifically for the SUD and behavioral health organizations that we are going to start working with. So they're going to be using the same reporting portal. So this is why we added this section on here.
Jody had a question in the chat box.
And we have another question. Yes, this video will be available on the portal. And we have quite a lot of narrative written for several milestones. Is there a place to write narrative throughout the portal? Do you want to need narrative? Yes, we do want and need the narrative because that gives us more context into your information. And there is a section where, for example, there's these narrative boxes provided, and there's also options where you can upload files directly onto this workbook.
And if you get to a point, Jody, where you see that there's a narrative box, there's not a narrative box where you would want one, you can just email me or Martine, and we can be in contact with the staff over at CSI, and it's very quick for them to add a narrative box.
Mm-hmm. And then again, choose an evidence-based instrument or tool to systematically assess patients. And again, it's multiple selection, which will be pre-filled for you guys from the information you guys provided from quarter 1. And then you guys see the other on here as well.
Another question.
What do they add extra to members?
If there's someone from your organization that doesn't have access or didn't receive an invitation, you can go ahead and email me. My email is ljohnson@gcach.org, and I'll send them an invitation.
We've got another one that says, can we ask questions? Like voice.
Yes, feel free to, if you have questions, feel free to ask.
Hi,
Hey,
I'm sorry, this is Mandy Olson, and I am feeling incredibly dense here, but I'm on the page. I'm on the landing page for Greater Columbia Practice Transformation. I don't have anything on the left that says measures or.
So if you're on this page, so click on Greater Columbia.
Yep.
Okay. And then on the left-hand side here, it's the Greater.
I don't have that.
Did you just register, Mandy?
Yes.
Okay, so if you just registered, sorry, go ahead.
I did today, but not like right this second, earlier today.
Okay, so if you did it today, I probably haven't had a chance to give you access to your reporting portal and your folders, but that's something I can do before the end of the day.
Okay.
And I can make sure
there's no urgency. I just was
that.
worried I was really not getting something. So I see
No,
now.
sorry, I should have clarified. So the process is everyone has to register, and then once you register, I get an email letting me know that you've registered, and then that's when I can go into the portal and grant you those permissions for your individual folders and reporting portal.
Okay, and I was just worried too, I had maybe put our organization in wrong or something and it wasn't linking it. But if you're doing that manually, then I won't worry about that.
Yeah, sorry, I should have clarified, but I will give you that access, and you should definitely have access before the end of the day.
Thank you all. Sorry.
How do you register?
Hi, can I ask a question?
Please, go ahead.
This is Stacy George from Community Health of Central Washington, and Jody had just asked the question about the narrative boxes, and we're in office together. So our question was more, I see that you have the narrative boxes at the end of each milestone and each question, but so for example, when we were looking at 2A3, and it says, question 2 says, select the care management activities that your practice uses for its patient population. And we actually wrote narrative next to each one that we use. And so I'm not sure how, yeah, I'm watching the screen. Ooh, okay, there you go. So like patient coaching, we wrote RN asthma medication teaching and did this big explanation next to patient coaching. And then I'm in question 2A3 question 2. And then like for education, we wrote a big narrative about how our EMR offers patient education, different languages, how we have all these tools. For monitoring, we wrote a big thing about how we do follow-up visits and watch for barriers to care. Home visits, we wrote a big thing about how our care coordination team does home visits, and we have home health, and we wrote a narrative for every single one that we said that we do. Should all of that, and we did that the whole way through the workbook. So if we said we did screening for anxiety, depression, and we used the PHQ-9, we wrote when we used that. In the Word document, it let us put it right next to the measure and right next to the field there. Should I put all that narrative in the other? That's what our question is. Or do you not want all that? You just want to know how to do it?
No, Stacy, we were just talking internally too. I think what would be best for you guys is to upload just the workbook that has that narrative where at the beginning of milestone 2, that might be the best. Or you could put it in supporting documentation. So there's a folder in the CHCW folder that says supporting documentation. That actually might be the best place for it. So anybody that has super long narratives, which were amazing. Like CHCW's narratives were great. They really helped a lot of folks, and we could get best practices from it. So if you have that, please put it in the supporting documentation folder, and Jeff went over earlier how to upload into that.
Okay, that's great. Thank you so much. Thanks.
Any other questions on the phone?
So here again, 2B1, and how have you organized behavioral health services in your practice, and again, multiple selection on here, and then there's the other, and like Jenna just mentioned, if there's narratives, you guys can upload in on the supporting documentation file on your folder. And then 4, which assessment of behavioral health integration have you used to assess your practice? And you guys will have the Maine Health Access Foundation, which is the MEHAS, and the Patient-Centered Medical Home Assessment checked, because those are the 2 assessments that we completed with you guys. And number 5, how are you identifying patients in need of integrated behavioral health services? Multiple selection, and then these, they indicate screening tools used for from question 7 below. So there's the narrative box where you guys are able to enter the narrative. Same for this one, indicating the diagnosis. And this one indicates target chronic conditions. If you guys select this option, you guys would be able to enter your narrative on here, and same for other. And then here's the narrative box, asking you to provide a narrative of how many patients are currently receiving integrated behavioral health services and how they are being tracked in your EHR or standalone registry. And again, here's the narrative box where you can upload a document to your supporting documentation. And you can just type on here, please see supporting documentation for question number 6. And then that way it lets us know that you provided your narrative. Okay, let's keep scrolling down. Question number 7, this one looks a little intimidating, but it's actually pretty easy to use. This one's asking what evidence-based instruments or screening tools are being used to systematically assess patients and monitor or adjust care. Select all that apply, and then also identify the team members responsible for applying or using the tool. So we hit, let's do the first one, the broader measures, brief psychiatric rating scale. We'll hit yes if you guys are using it, using it as an example. When and how is the tool applied? Then you guys can go here. It's being used to identify need for care, follow-up and monitoring, engaging patients in decisions about care, and plan care. So that's how that tool is being used. And asking who on the team uses that tool. So you hit the drop-down menu, and then this will pop up, and then you guys can hit physician, PA, ARMP, whatever applies. And then if it's not listed on there, there's the other, and right underneath, the little text box will appear that you will be able to type in the team member.
And a major difference of this question versus the workbook is question 7 on the portal is questions 7, 8, and 9 combined from the workbook. So we got a lot of feedback that it was kind of difficult to remember what assessment you chose and who does it and all this stuff. So this one, we just combined it, and they're all neat next to each other, so hopefully that should be a little easier. And we just typed Lauren's email in the chat box so everybody can have it. She loves emails.
Here at least 5
Yes,
times.
I did.
So for every option, it's exactly the same. There's a yes or no if you guys are using it, and if you guys aren't using it, just select no, and you guys don't have to worry about this. But if you guys are, just hit yes, who uses, how the tool is being used, and the team members that are using that tool. So we'll keep scrolling down. So there's all these tools, and again, there's the other. If those tools are not listed on here, you can write it on here. Hit yes, how it's been used, and the team members using that tool. And then number 8, what evidence-based treatment does your practice make available? Again, multiple selection on here. And then there's the other. And then this will actually be taken down to just leave the big narrative box. And then number 9, how and when does the practice do systematic case review? And then this is just one selection. So either weekly, bi-weekly, or monthly, and who is under review.
Lifestyles Clinic offers Ideal Protein, a ketogenic protocol designed to help you lose fat quickly and efficiently. Our program is built around a low-carb, low-fat plan that includes nutritious protein supplements and a personal coach.
So you guys see
You'll
here,
maintain your muscle mass, vitality, and energy. Plus, your appetite will be naturally suppressed. Visit your Lord.
Okay, there we go. So you guys see here with the review team, again, selection, identification and outreach to patients, again, selection, and then there's the other, and these are multiple selections. If you guys see the squared box. We do outreach, same thing, selection, what measures will use to assess integration of behavioral health and the impact of behavioral health services. There's a narrative, how have you increased your practice capacity, multiple selection on here, and then there's the other box, and then to be to self-management, choose one, and then you guys will only get the option to choose one. This little icon tells you more detail about that specific option. So if you guys see that little icon, it will give you more information. And again, for this one, the conditions, it's a drop-down menu, just selecting your conditions. There's the other that will let you write in your option, trigger for self-management, drop-down menu, and selecting. And then there's always the other, gives you the box, and then you just enter your numbers on here.
So does it allow you to go forward if you haven't put an answer in the box?
Yes. And so if you guys don't have an answer for one of the boxes, that was Carol's question, you guys can always leave it blank, and it will still let you advance to other questions and other milestones. And again, here, drop-down menu, and here you will have to type it in. Is it provided by staff or external resource, training credentials, and the number of patients that received intervention in the past quarter. So I'm gonna actually jump onto another milestone, but you guys see here, milestone is the biggest, milestone 2 is the biggest one. So if you guys have any questions when you guys are reporting, please feel free to, reach out to us. I'm gonna hit save, and it will save what I have clicked for the questions. So just bear with me a few seconds while it saves.
I have no idea how to log on.
And then we have, this is for Jeff. It says, hi, Jeff. I have no idea of my login information or the URL. Oops. And we can provide you with that information as well, Shauna. Right, Lauren?
Yeah, I can email you directly, Shauna, and help you. This is Lauren.
So now it's saved, and I can, instead of scrolling all the way up, I can just click this button, take me up, and it's already saved. It gives you the option here or here to save your data, and then we'll just jump on to milestone 3.
Make sure when you go to a different milestone that you hit save. I don't believe the system will prompt you to save your data, and so you wouldn't want to lose any changes. Make sure you hit save.
Yes.
So, hard way.
So after milestone 2, this, all the milestones are shorter. So this one's 24/7 access and by patients. Do you have 24/7 access? Yes or no? And again, that little icon gives you more information as to what that means. This one, number 2, this is multiple selection again, how your practice is providing enhanced access. And then there's the other. And then this table is the number of hours per week that staff spends on care provided outside of the office visits. So depending on what applies to you guys, which you guys have already provided that data, it will be pre-filled. And for quarter 2, it's just a matter of updating the estimated hours per week or the number of staff in each category. Again, there's the other, if there's the staff is not listed up above. And then number 4, how you guys are providing information that you guys offer enhanced access to your patients. So instead of plus you're in the office, from staff, on the website, and then there's the other. And then we had a question. So if multiple people end up on reporting, we can see where each other has left off correct. Yes. So if it's saved, whatever they have on there will stay. If, they, for example, say they stopped on this question, question number 3, and they hit save, nothing will appear on question number 4, and somebody else can go in and fill out that question. So we'll hit right, unless it's pre-filled, then you won't know who if it has been updated. Yeah.
So just communicate.
Yes. So make sure you guys are communicating, when you guys are updating or going to be updating information in the workbook. So I'll hit save again, and then we'll scroll up. Yeah. And then we'll go to milestone 4. All the milestones are laid out pretty similar. So hopefully by now you guys can kind of, see how it flows. Patient experience, practice-based survey. And if you click this option, it gives you these other questions as to how the survey is being conducted. One thing to note on here, and I learned this the hard way, if you type something on here, but do not click this box, when you hit save, it will not save. So make sure you guys, are always clicking on that box so it can save whatever you type on here. And then, so you guys will have to answer all these questions, depending on what options you guys pick. And all these options have that functionality. It will drop down, extra questions for you. And then the shared decision making, decision aids or tools, and then again, multiple selection on these, and then there's always the other at the bottom. And then who are the creators of those decision aids, multiple selection again. And then here, reporting, depending on the conditions you guys picked, say depression, you can either report it as a count or as a rate as to how many patients received those decision aids. Say 20 patients, received this decision aid on depression, or 25% of the patients with depression received a decision aid.
Do they have to report both?
No, either or. Either report as a count or as a rate. And again, hit save. Always remember to hit save. And then go up. And then we'll go to milestone 5. And again, same thing. This one is just one selection. Either yes, you have a QI team, or no. And then these are the clinical quality metrics. On here, one thing to note is that on the workbook, these questions were grouped together. Now they're separated, and this is more helpful. It gives us more information as to what exactly you guys are doing instead of us trying to guess or going back and asking you guys.
And this is consistent with the way that the GCACH is going to be reported on by those specific age cohorts,
right?
Or by the acute phase or continuation phase of treatment, or any other subcategory to a major clinical quality metric,
right? And again, these were grouped together, and they're now broken up into 2 questions or 2 options. And then if we scroll down more, you guys will see, all the other measures. And then there's always the other option on here. If the metric that you guys are tracking is now listed above, you guys can always write it in here. And then how often you guys are reviewing your CQMs for the entire practice site, and weekly, monthly, quarterly, depending how you guys are doing it, or EHR cannot support practice site level data or reports. And who makes the data available, multiple selection, how often individual practitioner or care team reports are being reviewed, weekly, monthly, quarterly, or you guys can't do it. And the most important question on milestone 5, have you engaged with your practice transformation navigator, either Jenna or myself?
I'll lie on this.
Right. So yes or no. And again, I'll hit save. And then once it does, I'll scroll up, and then milestone 6. Milestone 6, again, that's an attestation, yes or no. Number 2, you need to pick 2 options out of the 3, either option A, B, or C, and again, the little icon tells you more information about that option. And depending on what option you guys pick, option A, it tells you here for option A, this is where you're going to be inputting your information. And then number 2, again, multiple selection, follow-up of contact with patient within 1 week of discharge, how it's being done. And then option B, this is how you're going to be reporting. And then at the bottom, it tells you how to report for option C if you selected option C. So to save some time, I won't save this time. I will go to milestone 7. And again, this is a report that's not due until the end of quarter 4. And this is basically an attestation that you guys have been going to learning collaboratives, participating in learning webinars, and leadership council meetings. And then this will be filled out, and then you guys have the option to upload documents as well. So yes or no, and you guys will have to list the persons attending that have attended the learning collaboratives, webinars, or leadership council meetings. And then we'll go to milestone 8, which is the last milestone. Again, an attestation. Once you certify the HR, yes or no? Yes, so the data from quarter 1 is already populated. Jenna and I have entered that, and that carries over to the quarters 2, 3, and 4. So it's just a matter of going in for quarter 2 and updating information and narratives or any data that you guys have. And then number 2, the ability to exchange electronic health information with which other entities. You guys are able to exchange electronic health information. Multiple selection on here. And then again, please attest that your organization has met with your practice transformation navigator to discuss any issues or infrastructure needs that you guys are needing. And it's yes or no, and for the most part, it will be yes. So once you're on milestone 8, you hit save, and it'll save. And from here, once it's saved, you guys can just exit out or go back into the community, and your data will be saved. Yes. Any questions? And I'll unmute you guys so you guys can talk. I'm asking if you guys are asking.
At our free information nights.
Okay. Any questions that you guys have regarding the reporting portal? Comments?
It's just so user-friendly that there's no need to comment.
Any other comments you want to make, Lauren, Carol, Jenna?
I guess I just wanted to say and reiterate that we did send out the registration links Monday, and then I sent another round out today, probably about a couple hours ago now. If for some reason you didn't see that email, or if you lost it or accidentally deleted it, feel free to shoot me an email. My email is in the comment box, and I'd be happy to send you another one. And I see that a couple of people have already emailed me letting me know other team members that they'd like added. If anyone else has any other members or any questions for that matter, you can email me or Jenna and Martine. They're very familiar with the reporting portal and the community page, so we're happy to help.
And this will be posted, this recording will be posted in
Yep, and this recording will be posted in the videos. It'll also be posted in the user resources folder, and then we'll also, if you can't find it for some reason, we'll also have it on our website.
Donna, it says that you're self-muted, so go ahead and mute yourself.
Oh, it's so nice.
Oh, thank you, Donna. I didn't read the whole comment. I just you're not able to mute yourself. But thank you. And if at any time you guys need any technical assistance navigating the portal or the landing page, like Lauren said, please feel free to reach out to us. Oh, and Sam, our Director of Practice Transformation. You guys can contact her as well.
Okay, well, I think that's it. And thank you, Jess, for your review of the community page. I think that was really helpful. And thank you for everyone for calling in. We will hopefully hear from you soon. Don't forget, reporting's due on the 15th.
Happy reporting.
Thank you, guys.